the most forgotten flesh-eating disease in history. There is a disease on this planet so aggressive, so utterly devastating, that it can destroy the human face in less than a week. It doesn't target the elderly or the weak. It preys almost exclusively on children under the age of 6. Yet, most of the world has never even heard its name. Welcome to Medical Rounds. It's called Noma, or Cancrum Oris. For centuries, it has been a phantom illness lurking in the shadows of extreme poverty. It carries a staggering 90% mortality rate if left untreated. But what makes Noma truly terrifying isn't just how deadly it is, it's the horrifying speed at which it operates, transforming a simple mouth ulcer into a surgical nightmare in mere hours. How does Noma start? It begins with something almost every parent has seen: a small, swollen ulcer on the gums, or bleeding after brushing. It looks like a standard case of gingivitis. But within 48 hours, a process called gangrenous necrosis takes over. The rapid progression of Noma symptoms. Stage 1, the warning: bleeding gums, foul breath, halitosis, and high fever. Stage 2, the edema: the cheek or lip begins to swell rapidly, turning a painful, bruised purple. Stage 3, the destruction: the infection cuts off blood flow. In a matter of days, the soft tissue, skin, and underlying bones of the jaw, nose, and cheeks literally die and slough away. The name Noma comes from the Greek word nomein, which means to devour. It is a literal description. The disease eats through muscle, cartilage, and bone, leaving behind massive, permanent gaps in the victim's face. For decades, scientists struggled to find a single specific Noma virus or Noma bacteria, but modern microbiology has revealed a far more complex forensic truth. Noma is not caused by one single pathogen. It is an opportunistic polymicrobial infection. Essentially, when a child is profoundly malnourished, their immune system crashes. The normal, harmless bacteria living inside their mouth suddenly turn predatory. They breach the mucosa lining, trigger massive blood clots in the facial vessels, and suffocate the surrounding tissue until it dies. Noma is not a new disease. It was actually well documented across Europe during the Middle Ages, and it swept through concentration camps during World War II due to systemic starvation. But as global nutrition and sanitation improved, Noma completely vanished from the Western world. Because it disappeared from wealthy nations, fundings dried up. It became a forgotten affliction, localized primarily across the Noma belt of sub-Saharan Africa. For decades, advocates fought to bring it to light. Finally, in December 2023, the World Health Organization who officially added Noma to its formal list of neglected tropical diseases. This single decision unlocked global funding, research, and international medical aid. The absolute tragedy of Noma is that it is completely preventable and incredibly easy to cure if caught early. If a doctor catches Noma in its first few days, a basic regimen of standard, low-cost antibiotics combined with nutritional support stops the infection instantly. The cost of saving a child's life at this stage is literally pennies. But for the 10% of children who survive without early treatment, the battle is entirely different. They're left unable to speak properly, chew food, or even close their eyes. Today, volunteer international surgical teams travel to remote regions to perform complex, multi-stage reconstructive microsurgery. Using skin grafts, muscle tissue from the back, and bone restructuring, these surgeons reconstruct cheeks, noses, and jaws. They aren't just restoring faces, they are giving survivors a chance to reintegrate into society, go to school, and live a life without hiding behind a mask. Noma may be the disease that eats the face, but modern medicine is making sure it no longer steals the future.